Hey there. Clara lives in New York City with her husband Remy and their family. And recently, over the course of less than a year, they had some medical encounters at hospitals. Nothing super dramatic. Remy broke his ankle in August of last year. Hello, emergency room. Hello, ER Bill. They had a second baby in November 2023, a boy, who ended up needing to spend a day in neonatal intensive care. He's fine. They named him Isaac. And then one night early this year, Isaac just wasn't looking good. Lethargic. Had a fever.
We decided to give him Tylenol, and he spit it all back out.
They took his temp again. 103.5.
And we started Googling what is like dangerously high fever for a baby.
And yeah, for a baby that little, 103.5 is starting to get iffy. Like possible risk of seizure. It was late at night. No pediatrician. No urgent care. Hello, new unwelcome questions.
The last thing you want to be thinking about is, oh shit, this is going to be really expensive. You want to be thinking about, let's go to the ER right now, make sure he doesn't have a seizure.
So they went. And the folks at the ER gave Isaac more Tylenol. He didn't spit it out. His fever went down. They went home, relieved about Isaac and a little anxious about the bills. After insurance, it turned out, for all three encounters, they were looking at more than $8,000. Clara didn't think her family could afford anything like that. And the billing office, they were not offering super encouraging advice.
Basically, every time I've called, they said, why don't you start making small payments now so it doesn't go into collections?
However, Clara listens to An Arm and a Leg, where we've been talking about something called charity care for years. And this summer, we asked listeners to send us their bills and tell us about their experience with charity care. Clara was one of the folks who responded. And just to recap, federal law requires all nonprofit hospitals to have charity care policies, also called financial assistance, to reduce people's bills or even forgive them entirely if their income falls below a level the hospital sets. We have been super interested in charity care here for almost 4 years. Ever since a guy named Jared Walker blew up on TikTok, spreading the word and offering to help people apply through the nonprofit he runs, $4. And since then, we've learned a lot about charity care, and $4 has grown from an infinitesimally tiny organization, basically Jared, not getting paid very much, to a small one with like 15 people on staff. Jared says they've helped people with thousands of applications and helped to clear millions of dollars in hospital bills. And in the past year, they've been up to a lot, and they've been learning a lot. So before we pick up Clara's story, which ends with her offering a new resource we can share, let's get a big download from Jared. This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman. I'm a reporter, and I like a challenge. So the job we've chosen on this show is to take one of the most enraging, terrifying, depressing parts of American life and bring you a show that's entertaining, empowering, and useful. In early 2024, $4 put out a couple of big research reports. They documented how much charity care doesn't get awarded and why people don't receive it.
I feel like for a long time, we have been looking around at the experts, right? Who are the experts and where can we find them and what can we ask them?
So finally, they undertook a major research project of their own. They analyzed thousands of IRS filings from nonprofit hospitals and compared what they found to a study from the state of Maryland that was based on even more precise data. And they hired a firm to survey a sample of more than 1,100 people and then ran focus groups to dig in for more detail.
I think that what these reports have just revealed is like, we are the experts. And like $4 actually knows more than everyone else about this.
So the amount of charity care that hospitals do not give to people who qualify for it, their data analysis provided a number, $14 billion, which Jared and his colleagues say is a conservative estimate. And the survey showed that more than half of people who qualify for charity care do not get it. About 2/3 of those folks do not know that it exists. And some people who know about it just don't apply, and some who do get rejected, even though they qualify. So $4's conclusion, quote, we found that only 29% of patients with hospital bills they cannot afford are able to learn about, apply for, and receive charity care. None of which surprised Jared very much.
It's like, oh, like our assumptions have been correct on this. Like people don't know about charity care. The process sucks. A lot of people that should get it don't get it. And hospitals have put all the pain and all of the responsibility on the patient.
And those top-line findings put $4's accomplishments in context.
Like we have submitted over 20,000 of these financial assistance applications.
20,000 people. That's spectacular. I know you're counting the money. How much money is it that you're talking about so far?
I think we're closing in on 70 million in medical debt relief. So,
all right. It's a start.
There you go.
It's a start.
It sounds great. And then you see the 14 billion number and you're like, oh, shoot. What are we doing?
I know.
What are we doing?
It's the laugh crying emoji.
Yeah.
And so for most of this year, Jared and his team have been testing a strategy to take on a $14 billion problem.
We have spent the year trying to work with hospitals. We came at this, how do we put a dent in the 14 billion? If it's not going to be through TikTok and it's not going to be through individual patient advocacy, then what if we moved further upstream and instead of patients finding out about us 1 to 3 months after they get a bill, what if they heard about us at the hospital?
So Jared envisioned patients getting evaluated for charity care and getting referred to $4 for help applying before they check out. He was thinking,
maybe we could make a bigger dent into that 14 billion. And I think that was wishful thinking.
Wishful thinking. That is how Jared now describes his hopes that hospitals would see they could do better by patients with his help and, sign right up to work with him.
Well, they haven't, Dan. So we don't have, we've got one hospital. I don't know if there's a smaller hospital in the United States. It is Catalina Island Health. It is a small hospital on an island off the coast of California. And when patients go in there, they tell them about $4 and they send them over. That was what we were hoping to do with these larger systems.
Jared talked to a lot of hospitals. He went to conferences for hospital revenue department administrators. He didn't get a lot of traction.
This is one thing where I'm like, I don't want to be totally unfair to the hospitals. They're huge entities that you can't just move quickly like that. It is going to take a lot more on their end than it would on our end. We could spin up one of these partnerships in a week, and they're going to need a lot of time, and it's going to, how do we implement this? With the small Catalina Island Hospital, it was easy. But if you're talking to Ascension
Healthcare, that's a big Catholic hospital system. Big. 136 hospitals, more than 130,000 employees across 18 states plus DC. Jared says they might get thousands of charity care applications a month. A deal to steer folks to Jared? It's not a simple handshake agreement.
How do you do that? How do you implement that? I mean, it's a pain in the ass. And these hospitals, and more so, hospitals are not motivated to figure this out, right? Unless you're in North Carolina.
North Carolina. In 2023, North Carolina expanded Medicaid. And in July 2024, Governor Roy Cooper announced a program that would use Medicaid money to reward hospitals for forgiving medical debt.
Under this program, hospitals can earn more by forgiving medical debt than trying to collect it. This is a win-win-win.
So under the program, hospitals can get more Medicaid dollars if they meet certain conditions. One, forgive a bunch of existing medical debts. Another, make sure their charity care policies protect patients who meet income thresholds set by the state. And a third, they have to proactively identify patients who are eligible for charity care and notify those patients before sending a bill, maybe even before they leave the hospital.
I'm very excited to see how that looks in the future. Because if you remember, I'm sure I've said the big four, like our shit list is Texas, Florida, Georgia, North Carolina.
Jared's shit list. The states where, over the years, he's heard from the greatest number of people who have difficulty getting hospital charity care, and where he often has to fight hardest to help them get it. Jared's shit list, the Big Four, they were the four biggest states by population that had rejected the expansion of Medicaid under the Affordable Care Act. Because of how the ACA was written, no Medicaid expansion means a lot more people who don't have a lot of money and just don't have any insurance at all. It's a giant problem. And North Carolina was one of the states where it was the toughest.
And in, the span of a year, North Carolina has expanded Medicaid and created one of the best medical debt charity care policies in the country. And this law essentially says that they have to identify them early. So that's, on paper, it sounds amazing.
On paper, it sounds amazing. We'll come back to that. But first, let's make clear, this was not a sudden transformation. The governor, Roy Cooper, who we heard in that clip, he had spent 7 years pushing the state to expand Medicaid, and the legislature finally agreed in 2023. And then Cooper and his team spent months this year figuring out how to bake medical debt relief into the plan, which took a ton of maneuvering. Our pals at KFF Health News covered that process. Here's Ames Alexander, who reported that story with Noam Levy, describing the process on a public radio show called Due South. He says Cooper's team started out trying to quietly bounce their ideas off a few hospitals.
But then word got back to the hospital industry's powerful lobbying group. That's the North Carolina Healthcare Association.
Mm-hmm.
And the association was not at all happy about it.
They raised a stink and claimed the whole thing would be illegal. The feds shouldn't approve it. Roy Cooper and his health secretary, Cody Kingsley, they just kept going. And they did get the feds to sign off on their plan. So it was legal, but it wasn't mandatory. Like, they were offering hospitals money, but those hospitals needed to say yes. And that didn't happen right away.
When Cooper and Kingsley unveiled this plan on July 1st, there wasn't a single hospital official who would join them there for the press conference. Ultimately, though, all 99 of the state's hospitals signed on. And it's not really hard to understand why they stood to lose a lot of federal money.
Lose out on a ton of new federal money, like a ton. According to KFF's reporting, a single hospital system stands to gain like $800 million a year for participating. And, thinking about that, like how much money hospitals were considering turning down. Well, it kind of puts into perspective Jared's experience trying to get them to work with him because, he wasn't offering anybody $800 million a year. And I said to Jared, it seems like this would be hard to replicate elsewhere. Like other states, they're not going to be able to put that kind of new federal money on the table. And here's what Jared said.
I think before can we replicate it? I'm just like, how do we make it work in North Carolina?
That is, how to make sure when it gets implemented that it really works. Remember, Jared said before, this all sounds amazing on paper. So we'll have some of his caveats after the break, plus the rest of Clara's story. An Arm and a Leg is a co-production of Public Road Productions and KFF Health News. That's a nonprofit newsroom covering health issues in America. KFF's reporters do amazing work, like you just heard one of them, breaking down how North Carolina put that deal together. We're honored to work with them. So Jared loves the idea behind North Carolina's initiative on charity care. Hospitals have to screen people while they're on site. Let them know before they leave the hospital what kind of help they may be eligible for.
Making sure that a patient knows what is available to them before they leave is very powerful. That's where the responsibility should be. But how do you do it? And what happens if you don't? Right?
In other words, Jared says the devil is in implementation and in systems of accountability. And he's seen what happens when those systems are porous.
In Oregon, they had that law that was like, you can't sue patients without first checking to see if they're eligible for charity care. And then you find all these people that are being sued that were never screened.
Yeah, so Oregon passed a law in 2019 that required hospitals to evaluate patients for charity care before they could be sued over a bill. Jared's colleague Eli Rushbanks analyzed a sample of hospital bill lawsuits in one county, and he could only see patients' income in a few of them, but in almost half of those, that income was definitely low enough. The debt should have been forgiven. Those patients should never have been sued. And Eli also took a big picture look. Here's what he found. In the years after that law took effect, 2/3 of hospitals in the state gave out less charity care than they had given out before, which is probably not what lawmakers had hoped for. In North Carolina, hospitals will have 2 years to fully implement this screening requirement. It's called presumptive eligibility. Some hospitals around the country already use automated systems for this. They check your credit, pull other data. Some of them use AI. And Jared says he's seen some hospitals over-rely on this kind of technology.
Some hospitals that are using presumptive eligibility tools will use that as a way to say, oh, we already screened you, you can't apply. But the patient is sitting there going, well, I'm eligible. Your tool must have got it wrong because these things are not 100% accurate. Or think of something like this. You lose your job. Or maybe you're at the hospital because you just gave birth to another human. So now you're a household of 4 instead of 3. And obviously the presumptive eligibility tool isn't going to be able to know that and calculate that. So if you go to the hospital and say, now I want to apply, and they say, well, you don't get to apply because we already screened you and you're not eligible, that's bullshit.
So, as North Carolina hospitals bring their systems online, Jared wants to push for a process where patients can appeal a machine-made decision.
I'd love to be able to test that. How does that impact how many people are getting charity care and that $14 billion?
Yeah, what do you think is your best shot for the next year of kind of moving towards the $14 billion?
We are trying to figure that out. Obviously, the election will play into that. But I think that if I had to guess where we would land, I think that we will double down on our patient advocacy work.
Jared says they will definitely also continue to work with advocates and officials on policy proposals. But
the only reason anyone cares about what we have to say about policy is because we know what the patient experiences. So I think that if the more people we help, the more opportunity we will have to push policies forward that we want to see happen.
So this is a good place to note, if you or anybody you know has a hospital bill that is scaring you, $4 is a great first stop. We'll have a link to their site wherever you're listening to this. They've got a tool there that can help you quickly figure out if you might qualify for charity care from your hospital, plus tons of how-tos. And they've got dedicated staff to help you if you get stuck. And we just heard Jared say they're not backing away from that work, even as they aim to influence policy. About policy, Jared does have one other thought about their future work in that area.
We think that we're going to get a little bit more feisty moving forward. So I'm excited about that.
I talked with Jared less than a week after the election, and so we didn't even know yet which party would take the House of Representatives. And of course, there's still a lot we don't know about what things are going to look like from here. Jared had just one prediction.
I think we're going to be needed that much more.
I think we're all going to need each other more than ever. Which is why I am pleased to bring us back to Clara's story from New York City. You might remember her family had 3 hospital adventures in the space of a year. First one, where her husband broke his ankle, that got her started. The bill was $1,800 after insurance. It's a lot for their family, but she had a few things going for her. One, she knew charity care existed, and not because the hospital mentioned it.
No, I know about it from an arm and a leg.
Yeah. 2, she had the skills, because by training, she's a librarian. And you may already know this, but people come to libraries looking for a lot more than just books.
People all the time will come in and bring in a form or need help navigating different systems and even just looking and trying to help and see where to start.
And librarians are there to help with that kind of stuff. So Clara went and found her hospital's financial assistance policy online, saw that her family met their income requirements, found the form, submitted it, got offered a discount that still left her family on the hook for more than they could comfortably pay. and decided to see if she could ask for more. Was there an appeals process? There was. But she didn't find all the information she needed online. The process of looking wasn't quick.
A lot of phone tag. And I don't know if the bill pay phone lines are staffed better than the financial aid phone lines, but you get an answering machine a lot. You have to call back. The person doesn't remember you. They're not able to link your account, all of the things that I just feel like they're really greasing the wheels of the paying for the bill option, but actually not making it especially accessible to do the financial aid and appeal process.
Clara hung in there. Here's what she told my colleague, Claire Davenport.
Being a listener of the podcast, I feel like I'm part of a slightly bigger community of people who are sort of maneuvering through the crazy healthcare system. And I do kind of have Dan's voice in my head, like, this is nuts. This is not your fault. This is just crazy and not right.
Yeah. Also, when she was angling for more help on her husband's ER bill, she knew anything she learned there could come in handy soon, because she was due to give birth at the same hospital pretty soon. Her persistence paid off. In the end, the hospital reduced that $1,800 bill to just $500. 2 weeks later, Isaac was born and spent an extra day in the NICU. And that, plus the late night fever that sent them to the ER, left Clara's family on the hook for another like $6,500. Clara used what she'd learned the first time through as a playbook. Apply, then appeal to ask for more help. She says that made it a little simpler, but not simple, not quick. Isaac was born in November 2023. His ER visit was in April 2024. And when Clara talked with our producer in early August 2024, she was still waiting to hear the hospital's decision about her appeal. Like, was it going to be approved?
In the event that it's not, I think we just put it on like the longest payment plan we can. Maybe we would ask family for help.
Update. A few days after that conversation, the hospital said yes to Clara's appeal. Her new total, $650, about a tenth of the initial amount. Which, yes, that's a nice story for Clara and her family. But the reason I'm so pleased to share her story is this.
Actually, I made a template that you can let your listeners use for making an appeal letter.
Oh, wow.
I'll share it with you.
Cool.
Yeah, Clara thought it might be useful because part of the application and appeal process, not all of it was just facts and figures and pay stubs. There was also an opportunity to write a letter, which opened up questions.
I feel like it's not totally clear what you're supposed to put in the letter and who you're appealing to and how emotional you're supposed to make it versus how technical.
So here's how she approached it.
I was trying to think about if I was reading the letter, what would help paint the picture of this bill in context of everything, trying to put myself in their shoes reading it, what would be useful to kind of add more depth to our story than just the bill. And then also I just tried to be really grateful and express authentic gratitude for the great care we received.
She also included a realistic estimate of what her family could actually pay, which the hospital ended up mostly agreeing with. And yes, Clara shared that template with us. So we're going to post a link to it wherever you're listening to this. Please copy and paste and fill in the blanks. And please tell us how it works for you. A big lesson here is don't take no for a final answer. Don't take, we'll help you this much for a final answer. And Clara discovered one other thing. Don't give up if it looks like you may have missed a deadline, because she missed one.
So I called them and said, I'm really worried. I didn't send it in time. It might be off by a couple of days. Is this going to be a huge problem? And they said, no, don't worry about it. It's totally fine. Just send it. So I'm thinking, okay, wait, there are so many people who are going to get cut off or get their bill and realize, oh, well, I totally missed the window. So let's go for the payment plan option when actually...
If you've got the chutzpah and the time and the patience to make the next call and ask, you may get a different answer. It sucks that it's this hard, but I appreciate every clue that it's not impossible. And I appreciate Clara sharing her story and her template with us. So I told Jared about it.
Yeah, that's amazing. I mean, I love, it's so funny. It's just the idea of you have this patient that is going through all of this stuff and is so busy trying to focus on their own health, do their own thing. And they're out here making templates so that other people can, jump through the same hoops, because we know that we're all going to have to jump through the hoops is just, man, how frustrating is that? But how amazing is it that you have built a community of people that are, willing to take those kind of crappy, very terrible experiences and turn it into something that is helpful for other people. I think that's amazing.
Yeah, me too. So, this is where I ask you to help keep a good thing going. We've got so much to do in 2025, and your donations have always been our biggest source of support. And this is the time to help us build, especially because right now, your donations are matched. The place to go is armandalegshow.com/support. That's armandalegshow.com/support. We're going to have a link wherever you're listening. Thank you so much for pitching in if you can. We'll be back with a brand new episode in just a few weeks. Till then, take care of yourself. This episode of An Arm and a Leg was produced by Claire Davenport and me, Dan Weissman, with help from Emily Pisacreta, and edited by Ellen Weiss. Adam Raymunda is our audio wizard. Our music is by Dave Weiner and Blue Dot Sessions. Gabrielle Healy is our managing editor for audience. Lee Bosco is our consulting director of operations. Lynn Johnson is our operations manager. An Arm and a Leg is produced in partnership with KFF Health News. That's a national newsroom producing in-depth journalism about health issues in America and a core program at KFF, an independent source of health policy research, polling, and journalism. Zach Dyer is senior audio producer at KFF Health News. He's editorial liaison to this show. And thanks to the Institute for Nonprofit News for serving as our fiscal sponsor. They allow us to accept tax-exempt donations. You can learn more about INN at inn.org. Finally, thank you to everybody who supports this show financially. In fact, here are the names of just some of the people who have pitched in just in the last few weeks. You ready? Thanks this time to Philip Swayze, Marv Hoffman and Rosellen Brown, Jane Dunn, Janet Cochran, Henning Kolsman-Freiberger, Christy Loescher, Kathleen M. Kearns, Regina D'Angelo, Anna Critch, Damian Archbold, Dawn Fuller, Tiger Heiss, Diane Gorsica, Shelley Sims, Nancy Harrington, Deborah G., David Heineman, Christine Ebert Santos, Richard Hennigan, Mitch Keller, Matthew Schmidt, Sheila Connolly, Hetty Lima, Kathleen Kearns, Siobhan Lyons, Cindy Gatton, Keita Masaki, Ken Yonda, F.A. Organ May, Alex Levy, Jennifer Smith, Molly Schmid, Cyril Walter, Dr. Mo D, and Joe B. Thank you so much.